Shoulders back. Hi, everyone. I'm Sarah Stackhouse with Real News Communications Network. And, of course, we're here with Dr. Sally Fryer-Dietz of Integrative Pediatric Therapy, Integrative Concussion Therapy. How are you this morning?
Great.
Well, we are talking about craniosacral therapy and what exactly that means. It's kind of a big word.
Right.
Can you tell me a little bit about it?
Well, we call it CST for craniosacral therapy, but it's basically surrounds your central nervous system and has a lot to do with how your body works and functions. Mm-hmm. It's you can see here's a picture of there's a membrane that surrounds your brain, and then it comes down your spinal cord and it actually attaches at your tailbone. So the cranium or the cranial and the sacral
therapy. You know what?
Therapy.
I'm actually going to grab the phone here. We have Valerie behind the scenes who's helping us out, and I'll bring it a little bit closer.
Okay, then you can see.
Yeah. And bring it a little closer for us there.
So here you have your membrane that surrounds the brain, comes down the spinal cord, and attaches at the sacrum. With a concussion, there's a lot of stuff that happens around the neck as well as in the head. So it is really great for helping to relieve symptoms. One of the biggest problems that people have following a concussion is they complain of headaches. Mm-hmm. So this technique, we can have somebody come in with a terrible headache and actually leave symptom-free.
Oh, wow.
So it's very, very effective. It's very gentle. It's very non-invasive. It's one of those things that it's kind of the secret glue that helps with all the other treatments that we do. So if we do vestibular or visual therapy that a lot of times will stir up symptoms because it needs to in order to work, then we can follow it with the craniosacral therapy to help calm everything down so people leave feeling good and they can't wait to get back.
Yeah. And I understand that this is kind of a new procedure, right? Or not new, but
it's not really new, but it's new maybe to more medical literature.
Right.
We actually just published an article in
really quickly. I'll hold that for you.
So this was in Medical Acupuncture, but it was craniosacral therapy and visceral manipulation, new treatment for intervention of concussion recovery. And what we did was we worked with some ex-NFL players for 2 years in a row, took all there were 2 intensive programs, mm-hmm. and the results were they all came in, they'd had multiple injuries after a long, obviously, career of playing pro football with lots of symptoms, way more involved than somebody who's even had just 1, 2, or 3 concussions. But
You're constantly getting hit with that.
Yeah. And every one of them left feeling better. And 3 months later, their symptoms were still improved from when they started the program. Wow. So it's really making its way into more mainstream. We have lots of physicians, concussion specialists and physicians who refer to us for craniosacral therapy because it just it really, really helps.
Absolutely. Yeah. And I understand we were talking a little bit earlier that it's not just for concussion, right? There's a lot of other symptoms. It kind of deals with the whole central nervous system. There's a lot more to it, right?
Well, there's so much overlap. And part of the reason that we're a developmental therapy practice. So we've been working with kids for over 25 years here using techniques called sensory integration, working with the vestibular system and the visual system. Right. And as it turns out, when you have a concussion, what happens is you disturb the visual and the vestibular system.
Right.
So a lot of the same treatments that we use for developmental pediatrics really overflow very nicely into concussion rehab and really help to benefit the individual. So for kids with autism, with gut issues, lots of digestive issues, it's very, very helpful because the vagus nerve at the back of the neck. That can also happen with a concussion and whiplash in particular.
I would never think of that as something that would go along with it.
Yeah, it's kind of crazy, but everything's connected, so it makes a big difference.
So tell everyone kind of what room we're in and what the demonstration we're going to see is.
Okay, so this is one of our craniosacral therapy rooms. Every room is a little bit different. They're all very fun and inviting.
You can show. I love the painting on the wall and kind of all the stuff for all the kids here.
Yeah, but we use when we see children for craniosacral therapy, we'll often work with them on the swing, and we'll be able to sit at one end of the swing, and we have a child who's lying down or in our lap, and we're able to really work with that whole system, and the child is entertained and having fun, and it's very relaxing and that kind of thing. For our concussion patients, we usually do not put them on the swing, or certainly
Might
don't start them
throw
on the
you
swing.
off a little bit, yeah.
Yeah, because their vestibular system's already very sensitive. So, we're going to work with them on one of the treatment tables and really, work with their overall body and relaxation response.
So like our beautiful demonstrator here.
Here's Kayla, who's our ever-ready model.
All right, so I'm going to let her squeeze behind me. We're actually, and if you want to get kind of a little bit close, that way you can kind of see exactly what's going on.
Yeah, so with a craniosacral therapy session, it's a little bit like a massage, but it really isn't. Because the person is laying there, obviously fully clothed. We're able to work over the clothing and really feel the tissue of the body. And what we're going for is a total autonomic relaxation response. So when you approach a body, if you, traditional physical therapy, we're used to kind of making things move. With the cranial work, we're actually using a very, very light touch on the body. It's about 5 grams of pressure, which is about the weight of a nickel.
Oh my gosh.
Yeah, if I came in here and I just tried to move Kayla's leg and I'm moving around, her body actually gives me more resistance back. So if I come in with a very, very light touch and I just wait, her body doesn't have any choice except to relax under that touch with time. Can you tell the difference?
Yeah, absolutely.
When I do that. So one of the first things a craniosacral therapist will do is to evaluate the whole body for the tension patterns in the body. They may start at the feet, they may start at the legs. They'll have you've got fascia that wraps around the body this way. So there's a hand here and we can feel how that fascia is moving over the chest or the thorax. There's fascia there as well that we feel to see what's tight. And then in the head we have different what we call cranial vault holds that will actually feel what's going on. You can just close your eyes. I told her she could take a nap this morning. So this is Kayla hard at work today. But anyway,
we made her work the last live, right?
That's right. Last time she had to work too hard chasing lights around. But this allows me to really feel what's going on within her central nervous system, and it's a very, very subtle pressure. Watching a cranial session is a little bit like watching a sailboat race. It's not very exciting to just see somebody stand there with their hands on a person. But if you're on the boat or you're the therapist and she's the patient, you actually can sense this motion that goes through that picture that I showed you, that dural membrane around the brain and then down the spinal cord and into the tailbone. There's fluid in there, and the way it should move is it needs to expand, and then there's kind of a pause, and then it gets reabsorbed. So you've got this semi-hydraulic system going within your body all the time. When you have any kind of a force into the body, whether it's the head or the tailbone or a whiplash in a car accident, that whole system gets disrupted. And it tends to hold tension in different parts of the body. So this is one way that we can get in and help to really release that tension. One of the areas that we often find a lot of problems with is the neck.
In concussion or just in general?
In concussion in particular, because if you think about it, whether you're on the ice playing ice hockey or you slipped on a step or you were in a car accident, when you hit the ground, the neck is what is moving. And if you get any kind of a hyperextension of the neck or any kind of a whiplash effect in there, then you can hold a lot of tension that comes all the way down into your shoulders. Well, out the base of the skull, there's this big nerve called the vagus nerve. And that nerve is what innervates all of our gut and viscera, our heart rate, our intestines, how things work and move in there. So if that gets tight or irritated, then you can have symptoms of anxiety. The heart rate goes faster because it's irritated. You can have digestive issues. So our little ones who have colic and reflux, this is really good for. Same thing happens in birth and delivery where that head and neck gets hyperextended. You can get a lot of tension here that causes that colic or reflux. And then, with, again, a concussion patient, a lot of times they'll complain of their neck is stiff, their head hurts, all these things combined really can cause a problem. So just by doing what I'm doing here, what does that feel like, Kayla?
I feel your hands pushing up a little bit at the base of my skull. And it feels like this weird relief feeling up in my nose, if that makes any sense.
That's right, because you have within the skull and within the brain, there's, and I'll show you. I'm just going to let her head go just for a second.
Oh, Fred's over there.
Oh, yeah, I have Fred's sister over here.
Oh.
But this is a membrane that is inside your brain, and this is actually where your spinal cord comes through, so it kind of sits like this. If you can imagine, inside her head, this is something, it's a membrane system called the falx.
It's like an alien.
I know, it does look like an alien. So when my hands were on the back of her skull, right here, this was helping all of this stuff to release. So my hands are here. It's taking tension off of that, spinal cord as it's coming through the foramen magnum, and it's helping to release that tension.
It's so interesting to kind of hear all about how everything is correlated, and I would never think, having problems with digestion or stomach would be from,
right.
the back of the head.
Right. Well, so you think about it, your brain is this amazing organ, but it's more than what's just between the ears.
Yeah.
Okay, so it processes all that information, but how does it get all that information? It gets it through all those nerve endings that run down your spinal cord and touch every part of your body. So you could have an injury to your knee, and it could be transmitted all the way up the body. And so this is one technique that we're able to release and find and then release the tension patterns and how that runs through the body.
Yeah.
Just like if I took this sheet and I pull it, see that wrinkle goes all the way down to the base of the bed?
Yeah.
Same thing happens in the body. You've got, bands of fascia and tissue that if there's a force that happens somewhere, it causes a wrinkle that goes through the whole body. And so this helps it to relax.
Right. That's so interesting. And, I was kind of watching you as you were kind of touching her. How do you, how much training goes into this? Because I would think that excuse me,
right.
But, I'm just pressing on her arm. I would not know what to do or what to feel for.
Right.
I have any idea.
Well, so I'm a doctor of physical therapy. I've been touching people for a very long time, professionally.
Right.
So touch comes easy, but I was trained to touch, much deeper and make things change in the body.
Right.
You have an arm that's frozen. Well, we have to move it, and it causes pain and it hurts and all this stuff. When I first took my first cranial class, which was in 1995, I went to take it so that I could tell people why I did not think it would work.
Oh, how interesting.
Because I could not imagine how this light touch really could make a big difference. It was not in my medical training. I went to University of California in San Francisco. We were, mainstream. It's part of the medical school there.
Yeah.
And you learn anatomy, physiology, and, how to make things happen yourself.
Right.
So it was a big surprise and awakening for me to discover that not only could I feel things moving with this much gentler touch when you just kind of open your awareness to it and don't force anything, but really kind of let the body move under your hands, and then when somebody would work on me, what I felt in myself as things relaxed and released. So back however many years ago that kind of started me on this journey of learning more. The more I learned, the less I knew.
Right.
But because I didn't know how to explain it, I didn't know, it was different and it was kind of weird and woo-woo and, we just didn't, even though it's based on science, it's based on anatomy and physiology, and it was taught by an osteopathic physician.
Right. It's just a hard concept, I think.
It just, until you experience it or get to see somebody who's benefited from it, it's hard to imagine.
Wow.
But I can tell you, every single one of our concussion patients who leaves here after a craniosacral therapy session, they all come back. They all feel better. That's the best part of everything that we can do.
It's
you know,
very cool.
The best in that it feels the best.
Right,
You know,
right.
everything else is hard work. You just have to, do the work to make those things function better. But this is one technique that we have that really can have a major impact on how you feel,
right,
and reducing those symptoms.
Are there any questions that you frequently get when it comes to this kind of therapy, that or any misconceptions, or just you constantly are answering this question?
It's more that people don't understand it. That it kind of sounds like, well, how can light touch really make a big difference?
Yeah.
In your life. And until you experience it yourself, or again know somebody, it's kind of the seeing is believing.
Right.
And you've had a cranial session before, right, Kayla?
I've had a little mini session one time.
So do you remember what that felt like to you, even that little tiny mini session?
I remember that I was very congested and very clogged, and she worked a little bit, just a very mini session, and I felt like I could breathe better. I felt like my nasal cavity, my sinus cavity was all wide open. I get migraines very frequently. I didn't have a headache I normally get them at least once or twice a week.
Oh my gosh.
Like a splitting migraine where I have to go sit in a dark room. Didn't get one for about 2 or 3 weeks after. And that was with a mini session.
Yeah. It's very powerful. I mean, it really, really can make a huge difference. And one of the things that she's describing, feeling like your sinuses clearing and all that, has to do with that membrane that I showed you,
right,
and where the sinuses sit. And so when you take tension off of that system, the sinuses can drain that pressure that gets built up there that can cause, headache, pain, and all that kind of thing. Drains and takes the pressure away.
That's incredible.
So this is another kind of favorite. Most people, where my hands are on her ears, and I'm just very, very gently, again, that 5 grams of pressure, just put a nickel on your finger and see how light that is.
I mean,
That's
it really is incredibly soft and very delicate.
Yeah, and this just opens up that whole membrane that runs straight through her brain.
So if people want to come, try out a therapy session, talk to you, ask questions, what is the best contact? What's the best way to get in touch?
They can call and make an appointment.
Perfect.
Come in, have a craniosacral therapy evaluation. It's $250, but it's with a certified craniosacral therapist who is going to assess all the different tension patterns in the body and figure out, well, what is it that's going on, and kind of guide you on, well, what do you do, from there.
Yeah, absolutely. So wonderful. And we have, of course, the Facebook page is tagged, so they can also go there, send messages, ask questions, and below. And I want to make sure that we've answered all the questions perfect. So is there anything else that you think people should know or hear?
You have anything you want to add, Kayla?
It feels amazing. It really, when I tell you I get chronic migraines, twice a week I have to go sit in a dark room and close my eyes and just be silent. But I'm telling you, about 2 or 3 weeks, I didn't get one, and that was the shortest session. All she did, it's so soft, it's so relaxed, your whole body just kind of melts into the table. Even if you have it, because I had a headache, and that's why she came and she's like, let me just work on you for 2 seconds. My headache went away.
That's awesome.
It was amazing. It feels fantastic. I could lay here if she wants to keep going.
Yeah.
So, just imagine if you, again, have an injury and you're trying to recover, and it's so hard to break that tension, fear,
and the stress, too, I imagine, of just, being injured.
Right.
Perfect.
Yeah, it makes a big, big, big difference. So thank you for being our little model.
Yeah, thank you.
Thank y'all.
Well, thanks so much for joining us. Okay. And, of course, if anyone has questions, we'll be monitoring here below. Make sure you reach out to Integrative Pediatric Therapy or Integrative Concussion Therapy.
And that was just the initial evaluation is a lot more in-depth, so it's a little bit more, but treatments are definitely less, and they're well worth it. It really makes a difference.
All right. Thanks so much, Dr. Sally.
Thanks.
Bye-bye.